my name is Aris, and today's presentation introduces a compelling evidence-based fund model that empowers staff to lead the organization's sustainability transformation. Over the next 10 minutes, I'm going to take you on a journey from a problem that Alfred Health knows all too well to a practical, tested, and fundable solution. By the end of this presentation, you will clearly understand the problem, the opportunity, and the pathway to action. Let's start by introducing Alfred Care Group. Alfred is widely recognized as a leader in sustainable healthcare. Since 2008, they have established 30 local green teams, cutting total greenhouse gas emission by 16%, reducing stationary energy use by 10%, and diverting 19% of waste to recycling. As a leading healthcare institution, the organization is committed to reaching net zero emission and building a culture of low carbon innovation across all departments. That ambition is what today's presentation addresses. So, this brings us to the challenge of designing a sustainability innovation fund that helps hospital staff turn sustainability ideas into measurable actions. When we examined this challenge, one thing became clear. Innovation is already happening at Alfred Health, but it's happening informally and inconsistently. There is friction between idea and implementation, and friction kills momentum. On this slide, we've summarized that friction into three interconnected barriers. First, staff capacity. People are passionate, but they're busy. A nurse finishing a 12-hour shift doesn't have the time to write a grant application. Second, structural barriers. There is no clear funding pathway, no knowledge of procurement process, and no leader to guide ideas through the system. And third, a narrow definition of sustainability. Most efforts stay stuck at recycling and switching off lights, while the bigger systematic opportunities go untapped. Thus, my presentation today will focus specifically on the fund design and staff onboarding experience. To understand the challenge properly, I drew out a stakeholder map centered on the Sustainability Innovation Fund. Moving outward from the center, you can see the key stakeholders, mainly the clinical staff and patients, followed by the Alfred Foundation, government, patients' family, and the wider community. The system is influenced by carbon targets, budget pressure, clinical governance, and patient safety requirements. After being clear about the challenge and stakeholders involved, we moved into the design process. We began by identifying our assumptions and then tested them through staff interviews and credible research. The validated insights gained became the foundation for our solution. Second, we repositioned the challenge. Instead of asking why don't staff submit ideas, we reframe it to what would need to be true for a busy ICU nurse to apply after a 12-hour shift. That shift grounded us in staff reality and pushed us to design for simplicity and support. Third, we used rapid ideation through Crazy Eights to explore multiple fund models. By sketching three selected solutions, we uncovered patterns around progression, support, and structured evaluation. After working through these processes, a clear pattern began to emerge. It shaped the structure of the final solution, which is a stage-gated funding model that provides small milestone-based funding upfront with additional fund release as project meets defined milestone. This fund model is anchored in four core design principles. First, low barriers and wide access. Since staff are time poor, the fund must be easy to enter. The application is short, simple, and open to all staff with a goal to unlock ideas from across the organization. Second, strong alignment with hospital strategy. Every idea submitted must demonstrate how it contributes to Alfred Health sustainability targets and patient care priorities. This ensures the fund is not operating on the margins, but reinforcing institutional growth. Third, support beyond funding. Money alone is not enough. Each successful applicant also receives structured support, including project management guidance, finance input, legal considerations, and technical sustainability advice. This reduces risk and increases the likelihood of implementation. Lastly, a focus on skill and sustainability. Through stage funding and a clear evaluation criteria, Successful ideas can move from pilot to broader implementation, ensuring the long-term measurable impact. Together, these four principles transform the fund from simple grant pool into a structured innovation model. To translate these principles into reality, we came up with a stage funding pathway. Rather than funding everything at once, the model releases support progressively, rewarding evidence and reducing risk. The fund operates on three tiers, starting off with a seed tier for a 6-month micro project with small fund for quick wins, such as trialing a new process or swapping out a product. Moving on, a growth tier provides gradual funding for pilot projects that need a bit more runway. And lastly, a scale tier that funds larger scaling for department-wide rollouts with demonstrated early results. To see how this fund works in a hospital setting, let me introduce you to Dr. Innovator. Dr. Innovator is a staff at the Alfred. He has an idea for a reusable gown trial that could cut waste significantly without compromising infection control. He saw a poster about the Sustainability Fund and scans the QR code to access the website for more information. He then submits his idea through a simple Google form, and AI will then filter the ideas in the pool to improve efficiency. The AI is used solely for filtering ideas, so there will not be a breach of privacy information. A multidisciplinary team will then review the proposal and decides whether to move on or not. In this case, Dr. Innovator idea meets the criteria and receives seed tier funding. He then leads the 6-month micro project for his idea. After reviewing, the results are positive and the idea proceeds to further scaling. After building the prototype, we introduce it to 20 different stakeholders to get feedback. An ICU nurse told us that even with the fund, she is not comfortable to start it by herself. We figured out that guidance to start off the ideas is essential to navigate governance, costing, and sustainability impact measurements. Thus, we suggest a mentor matching system that pairs each applicant with a sustainability champion and a finance guide during seed tier. Next, one of the managers that worked in the hospital setting questioned us on the measurement of impacts for each tier and how can we keep track of it. We realized that evidence of carbon reduction and patient care improvement is needed before committing further resources. So, we suggest an outcome dashboard that tracks carbon reduction indicators and captures patient care impact metrics with transparent reporting. Lastly, Alfred Health sustainability officers were worried about the longevity of the fund. Sustainability funds fail when they lack long-term structure. Thus, we encourage them to capture and reinvest cost savings from successful projects to create a self-sustaining fund. After all that we've discussed, let me give Alfred Health 3 concrete time horizon recommendations. In the immediate term, start designing the website and paste informative posters around the hospital spaces before the big launch day of the fund. In the medium term, run small self-nominated staff projects using only the seed tier, then analyze the outcome dashboard data before moving on to grow tier and scale tier. In the long term, embed the fund in Alfred Health's annual sustainability budget. Publish an outcome report while exploring external co-funding. In conclusion, Alfred Health already knows what needs to happen. The Sustainability Innovation Fund is exactly that mechanism that bridges between knowing and doing. This fund creates the pathway and it positions Alfred Health as a genuine leader in sustainable healthcare for Victoria and for the nation. Before I end my presentation, I want to take a moment to acknowledge the people who made this work possible. To Alfred Health representative Laura and Annabelle, thank you for bringing this challenge to us with genuine openness and engagement. The work you're doing on sustainability is important, and we hope this proposal adds value to that journey. To our coach, Mariam and Pratamish, thank you for the guidance, the honest feedback, and for pushing us to think more deeply at every stage. And to the 20 stakeholders who gave us their time and honesty, this proposal exists because of your voices. Finally, a big thanks to my team. We came to this challenge from different disciplinary backgrounds, bringing together system thinking, design, research, and strategy. Rennie led stakeholder mapping, while Sanaya and Anu drove the design process. Jack and Ushma anchored our literature review. Louisa and I developed the fund's governance structure and financial model. Guided by our coach, we were united throughout sustainability, collaboration, system thinking, human-centered design, and evidence-based practice. So that's the end of my presentation. Thank you.